everyone, and welcome to Let's Just Do This here on your TV. I'm Margaret Wallis-Duffy, and beside me is my co-host, Mr. Todd Miller.
Hello.
How you doing?
Doing very well.
Good. Are you ready to have an educational discussion about our eyes?
Always.
All right. And it's not just going to be a regular everyday discussion about eyes, but something that you're really going to want to tune into because it's something that all of us use day in and day out. A smartphone. And what better person to be having this discussion with us than Dr. Carolyn Teske. Now, Dr. Teske has been on our show before. She is a colleague, she is a friend, and she is my holistic optometrist. Dr. Teske, welcome to the show.
Thank you so much.
You know, it's always great to learn from you. You've been in practice for 23 years. 23 years. And I have to tell all of our listeners and viewers that, you know, and I do kind of brag about you as my optometrist, but I mean it from the bottom of my heart because you practice very differently than what I've been used to. You are a very integrative, holistic type of optometrist. You believe that the eyes are a window to the rest of our health, but you don't even just talk the talk, you walk the talk in your life, in your practice, and in the way you take care of patients. So our discussion today about eye health, and more in particular about what these smartphones are doing to our vision, you're going to take a real holistic approach as you always do. So welcome to the show.
Thank you so much. And I honestly am thrilled to be here. You know, I think from the beginning, I've always considered the eyes to be the window to the rest of your body. But now, especially in this last chapter where we actually have been putting our work together, I'm seeing the success stories that happen when healthcare professionals work together.
So what Dr.
Awesome.
Teske is referring to is our Better Together mission, bringing complementary and conventional medicine together, where we're putting the patient at the center, giving them and empowering them with education and tools to help them invest in their own health, and to actually take control and action so that we are all better together. Dr. Teske and I, when's the last time you saw a massage therapist working inside the walls of an optometry office? I don't massage eyeballs, but we do a lot actually together to improve the health and well-being of our patients, both from an eye perspective as well as a physical perspective. So our partnership is something I treasure, and certainly the patients are seeing the benefits. So today, I want to kick off this discussion about smart devices and what they're doing to our eye health. I know we love to talk about the research. So can you first of all put some parameters around the reality of what our device-filled world is doing to our vision?
Absolutely. You know, technology is tremendous. It's allowing us to hear this broadcast, to see, to use computers, iPads, cell phones. But technology, we can't ignore it. So we have to embrace it and recognize what it's doing to our eyes. So in Waterloo, there was a study released about a month ago. They looked at the population of patients, 6 to 8-year-olds. About 6% of them were nearsighted. So needed glasses for distance because their world was here. In the 11 to 13-year-old age group, 28.9% of the population is myopic or nearsighted. So between ages 6 and 13, this is what happens, right? We are using those devices. So in the study, they took those children and sent them outside for only an hour a week. Not an hour a day, but an hour a week. And that number, 28.9% nearsighted, became 14.
Wow.
So we always like, when we're educating, to share with patients tips that you can do that are simple, that control the challenges that we're faced with. Devices are here, right? Devices are here to stay. So sending your child outside for an hour, or giving them tools like we're going to talk about today, courtesy of supporters of our project like Nikon Canada. They came out with SmartBoost. So be smart, be connected. SmartBoost. All of my children actually wear these lenses, so they're spectacle lenses that have magnification at the bottom that actually help you reduce your focus demand, reduce your eye strain, see your cell phone better, and all of a sudden now create less of an impact of using those devices. Amazing.
It is amazing. I want to just go back very briefly to the study and,
course.
and putting our children outside for an hour. Not only, what I love about the work that we're doing, not just you and I, but this collective team of Better Together health professionals, from doctors to therapists to pharmacists, we're all working together. The benefit for our vision, but also just getting outside in nature. We just had Dr. Hilary Webster on the program, and she's talking about how nature can reduce cortisol levels and how that can have an impact on our overall health. And so isn't it amazing when we can look at a study about vision and then getting our kids outside for an hour, how that's going to have a massive impact, but it's also going to do good for other parts of our health. That's the way you practice and what makes you so unique and different.
Oh, thank you.
But that's also, and why I'm saying that is not just to pump your tires, but you're on a mission so that all optometrists and all eye care professionals look and view it this way, correct?
Absolutely, absolutely.
yeah.
It is more effort, I will be quite honest with you. I mean, if you're only looking at the eyes and working in that little silo by yourself, then the work gets done more efficiently, right? More quickly. But really, we're not providing better healthcare, right? We need to work together.
I'm no expert. I'm assuming our vision is somewhat finite. We cannot see very well forever. I mean, there's probably technology like corneal transplants that are coming down the road somewhere along the line, but we really need to protect our eyes. And aside from things like SmartBoost, what else can we do to really protect our vision?
Simple things like just recognizing the effect of using that device and just doing what we would call today, the lingo on the street is visual hygiene, right? So give your eyes a break. I had a patient recently who said to me, my vision's fine, I see pictures well, but after I stare at my iPad for a few hours, I look up and I can't refocus, I can't see properly, and it takes a long time to readjust. So the reality is just looking up even 20 minutes. We've talked before about that 20-20-20 rule, right? And it really is just recognizing, simple, right? Just look up every 20 minutes and blink 20 times.
So let's talk about what it actually means, a smartphone, and why a lens like SmartBoost is helpful. Can you speak to, what's happening with the eyes and with devices? Like why people need to understand, or at least I want to understand, what is it about the devices that are causing these issues with our eyes, and then link in how a different lens actually helps.
For sure. So imagine your eyes very much like a camera. So we have to zoom. And the closer that you hold things to look at, the more you have to zoom. So what SmartBoost does is zoom for you, right? So it's essentially a 7% magnification at the bottom of that lens. It is not a progressive or a bifocal, it's still a single focus lens. So there really is no distortion. In fact, I'm wearing them, right? So you can't really tell that it's anything different other than glasses. But what it does is Nikon has set it up so that it's doing the job for you. Right? So instead of your eye having to zoom, the glasses are zooming for you, which therefore relaxes your need to focus.
Wow. And so from the perspective of even fatigue in the eye,
Absolutely.
it's going to make a huge difference.
For sure.
Now, you mentioned your children, so your teenage, and I guess Jessica's not a teenager, your 20-year-old. Is this good for all ages?
Absolutely. Probably even more importantly, that 20-year-old, she's in university. Right? So really, anyone who owns a smartphone, anyone who uses a device, which, my mom's going to be 82 in a week, and she uses a device. So I think, everyone at one point probably has some kind of device in their hands.
And we really don't think we're doing harm to our eyes when we're reading an ebook or, checking the weather, but you're using your eyes again with that electronic device.
Absolutely.
Now, many of our listeners and viewers might have heard about this thing called blue light. Can you speak to what is blue light and why should we care?
For sure. So blue light is the light that is emitted from your device, which we believe has some damaging effects to your eyes. So on my spectacles, as are on yours, there is an anti-reflective coating. And that coating over top of that plastic lens that SmartBoost has reduces the amount of blue light, or eliminates blue light from getting into my eye. So it is an anti-reflective coating that is providing protection, essentially.
And so, and once again, it's not going to change the look of your
Not at
glasses.
all.
Because, I know a lot of people, I've had to, glasses for me, Dr. Teske, as you know, as my optometrist, have been relatively new. And it's something, though, fashion, it matters, but none of that has to be compromised
Not
with
at all.
something like
Not at
this,
all.
which is really, really important.
I can imagine if it did look obvious, people would have, some sort of be self-conscious about it. I'm glad that it's, very unobtrusive.
Now, I'm familiar with this because I, of course, know about the SmartBoost, and we had the opportunity of educating, thousands of millennials at the baby show in Toronto back a few months ago. And one of the things that a patient reached out to me, who I'd referred, was talking about how they're difficult to clean. I know this is kind of a little bit off topic, but we love to be practical and let's just do this. Why is it that they're a little bit more difficult to clean, and what's the solution?
For sure. So, we've talked before about your cornea needs to be hydrated, so your window needs to be clear, and, you need to use lubricating drops that you should use when you're using devices. Well, if my spectacle lenses also are not cleaned properly, then from the same kind of analogy, you're not going to see well. These anti-reflective coatings that are layers deep, I think Nikon was one of the first, or was the first, because they certainly emphasize a lot of, research on development, and they put a lot of energy there. So they were one of the first to develop a blue light coating. They're multi-layered, and because they're multi-layered, the anti-glare property hates water. So it loves everything else. Dirt, dust, lenses, just attract everything. So often, we provide a spray and a cloth, which, I use on the fly, but I have to tell you, when my skin gets oily or we get, some oils from, the environment on the lens, that doesn't come off with my spray or the cloth will build up. So I really run my lenses underwater in the morning, use very mild hand soap that I, like foamy soap, take the oils away, then wash it off. And once you do that once a day, then you can use the spray on the fly. And it very much is like the streak in the window of your car, right? Sometimes you need that soap to just get away the oil.
Well, and I love giving practical tips like that because this was brought up in my clinic just the other day. So thank you for answering that. I hope you're going to stick around. We've got to take a quick break, but we want to talk a little bit more about smart devices, maybe even talk about training the eyes a little bit, and finding different ways to improve our eye health. So stay tuned. We'll be right back here at Let's Just Do This.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy and Dr. Carolyn Teske. There are a plethora of places where you can buy these cheap glasses, and a lot of people tend to use them just to fix a quick problem. What are the issues with using cheap glasses?
Or cheaters, I think we call
Cheaters,
them.
are
Yeah,
they?
I think
Okay.
we call them cheaters.
Why would somebody need to invest in high-quality eyewear?
So, cheaters have that label because they do just that. They are a quick fix, to magnify and help you see with less effort.
Okay.
Is it what everybody needs? Well, especially if you're very cost effective and at the dollar store, then the optics that you will get will certainly reflect what you're paying. Not everybody has equal eyes. So when you are using magnifiers or cheaters, then you're giving right and left eye exactly the same. And maybe they don't need that. The other reality is, a focusing lens or a magnifier, which is what a cheater is going to work in one spot. Our world, I need to see here, I need to see there, I need to see there, I need to see over there. So we have so many different distances where we need to have our vision corrected that on-off really doesn't work so well.
Or having three pairs and
yeah.
swapping between them.
Or two at the same time,
Yes.
even, or
Wow.
2 plus 3, or plus sunglasses. I've seen that too. So, and I think, you've used this analogy before, Margaret. We don't know what we don't know. Mm-hmm. And more often in my clinic than not, patients will put on prescription lenses and go, wow. I didn't realize exactly how clear I could see until someone showed me.
Wow.
So I'm not advocating that you should never have cheaters, because certainly, you need a collection. When you need reading glasses, you need a library, right?
Yeah, because we
So-
sometimes have them on our face, and I'm saying, where are my glasses? or they're in
Absolutely.
16 different
These
places in the
little
house.
chains?
Yeah,
No,
not
no,
going
there's
there.
no chain.
We're not doing the chains. When you're a woman, I'm not
Do
stupid
the
at that
hair
level.
if you need to
Yes.
here. But, so the reality is, your primary eyewear, wherever it is, and this is what I usually recommend to patients, wherever you're going to do the most work with your eyes, that's where your corrective lenses should be.
Okay.
And then if in the glove box of your car, so that you could see that little fine print, you want to have the cheaters, then that's easy,
The map,
right?
the menu, whatever.
Exactly.
Okay, so another thing that I'm sure our listeners and viewers are wondering, because I certainly have. So if you perhaps don't love wearing glasses, or maybe you've gone and had laser surgery done, and so that you don't have to wear glasses, we're now talking about devices and the impact it's having on our vision, and SmartBoost. So how does that come together? So how do we get around that aspect?
Well, after laser surgery, the goal really is to reduce your dependency on eyewear, right? And very commonly done now, we correct one eye for far and one eye for more intermediate distance, so that your dependency on glasses is a lot less. But we talked about how visually demanding our world is,
Yes.
right? And there is nothing wrong with having that task-specific eyewear so that when you are doing that prolonged use, that your eyes are balanced, right? And I think, if our strategy is reduce dependency, not I'm never going to ever wear again, then I think that's a realistic goal.
Right. And when we always talk about prevention, so when we're using, and certain people are on devices with their jobs or with their careers a lot.
You pointed at me.
Exactly. So, having an option in their toolbox like the SmartBoost, so that you can actually reduce that strain and that cascading effect that can happen. I know that Dr. Teske, last time you were on the show, you talked to me, and of me as seeing you as a patient, you talk about eye drops as part of a preventative measure. That falls into all of this, doesn't it, when it comes to
Absolutely.
eyewear? So can you just remind everybody, those that have not heard your story, about making sure we're using eye drops and preventatively, and why that's important?
For sure. Much like when your skin is dry, whether it be your lips or in your mouth, by the time you feel dryness, you're in trouble, right? So by the time you feel your eyes are dry, then already they have been dry for some time. They should never feel bad. So I literally get up, brush my teeth, put my eye drop in, usually have some omega-3s because that also helps dryness, and then my eyes feel wonderful. And then I see well, right?
Right,
And
exactly.
similarly with glasses, by the time you're feeling headache, eye strain, tired eyes, or if the rest of the body is not happy, your eyes won't be happy either. That's where there is tremendous options,
And
right?
this is what excites me, and I know he often giggles at me because I get so fired up. But just this week in my clinic, I saw a young teen that's coming in for headaches, specifically for headaches. And yes, their backpacks, the musculoskeletal issues that kids have with their poor posture, and often as a result of this, anterior head carriage and what have you. And so I treated this young patient. And yeah, we were able to, to justify that it might be the cause of some of the headaches. But then I had a conversation with the mother afterwards and talked about vision. And that's when the referral happens to you, Dr. Teske, because, first of all, I want to know the role that vision is playing in the way that this is manifesting in this person's body. Interestingly enough, she did say to me that she was very interested. She had heard in one of our posts from the baby show about SmartBoost, and she said right away her daughter loves glasses just because she likes to be stylish. Is it possible without a prescription?
Absolutely.
That's what I wanted to know. So you can still wear
sure.
even without a
Yeah.
prescription.
My youngest child does not need corrective lenses, so there is nothing at the top of that lens and that magnification at the bottom.
Fantastic. So here we are sitting here discussing eyes and eye health and the impact that our device world has on it. But we've got a set of pink boxing gloves.
They're mine.
Yeah, they're yours. Yeah, matches your outfit. I love how you love to tell stories and how you pull together integrative health. And in the green room, we posted this on social media if you want to go and take a look. You had Todd with his dukes up and showing him how to box. Why are we talking and showing boxing gloves with an eye doctor, and how does that relate to our vision?
You know, every day I see and or feel the success stories of us working together. And this morning, and this is not a created story, this is a true story. This morning, my personal trainer and I like to do kickboxing. And we have talked before, and I think, you know, you've participated in the conversation, we talked about vision therapy, right? So the eyes bring you a picture, but the brain gives you vision. And now in my clinic and in many other clinics, we are doing what's called vision therapy, where we're training the brain. One of the most important principles at training the brain is what I call crossing the midline. So that means you go from one side to the other, like this. So this morning, as I'm working really hard doing this kickboxing, I said, how cool is this? I am training my brain with my boxing gloves. What an awesome way to teach that 5, 6, 7-year-old adult child to use and engage both eyes at the same time, train their brain, and get physically fit too. How cool is that?
That is so cool. And I mean, I've done kickboxing and with your personal trainer, because it happens to be my personal trainer as well. So I'm surprised you were able to use your brain while you were doing that, because she can be brutal. That's a shout out to Leslie Spicer. Let me tell you, she's amazing. So when you talk about vision therapy, you're now doing that in your clinic. So can you just briefly tell us who can benefit from vision therapy now that we've brought it up? And then, of course, that the at-home version, you can get out your boxing gloves and actually train your eyes.
For sure. So Dr. Carrie Stashuk is a behavioral optometrist working with me, and our vision therapist, Rosie McRoberts, are physically seeing and doing vision therapy with a group of very different individuals. We have, you know, adults who have had concussion, who have had stroke, who have had some kind of brain injury. All of those patients benefit from vision therapy. Most or many of patients who have been identified with a learning disorder, ADHD, ADD, they often will also have and or may only have a vision processing problem. So the problem really is processing in the brain, not only having attention deficit. But you can appreciate if it's difficult for you to process what you see, then of course you're not going to be very attentive to learning.
Right.
So a lot of ADHD or ADD patients actually have a vision processing problem, you know, or autistic children. Or, you know, just patients who struggle with reading, right?
Right,
So,
right.
you know, your eyes bring the message to your brain, and they have to be a team. So a lot of the exercises we do have, you know, a ball hanging from the ceiling, and, you know, you're pointing to different letters and keeping your body and your eyes engaged. That was exactly what I was doing this morning, and I had no idea.
That is so neat.
Another tool for your toolbox.
Absolutely, absolutely.
You know, Dr. Teske, you are committed to education as well as making sure that we give the science behind things. I'd love for you to briefly just talk about your collaboration right now with the University of Waterloo and the study that's happening right inside the walls of your clinic, because this is such important work, and you and I are both committed to integrative health and to education. I love the fact that we're partnering and linking arms with research project. So if you could speak to what you're doing and what we hope to see the outcomes from this research study.
Absolutely. In fact, our PhD student who is seeing patients today is excited about results. So microcurrent, so small electrical current applied to various parts of the nervous system reduce inflammation. Now, I learned that from you, which was really cool. You introduced us to that technology probably 3 years ago. And I was actually sitting at a vision therapy training conference listening to Dr. Ben Thompson talk about microcurrent that he was using in lab to treat lazy eye or to increase vision in a patient who's had poor vision in one side. So I approached Dr. Thompson and said, you know, what you're doing in research sounds like what we're doing in clinic. Maybe we could do something together. So he's already seen the benefits of microcurrent with the electrodes that he's using. You have, and I have witnessed already what microcurrent does with a tool that patients can own and can have on their own for inflammation elsewhere in the body. And now we are attacking the nervous system and creating tremendous change.
Oh, it excites me so much because, as you said, it empowers the patient. It's Health Canada approved. It can be put in the hands of a patient, and it's natural and safe, but exceptionally powerful. And that's one of the things I love about being able to partner with you. Very briefly, seeing a woman's eye close for the first time in 15 years after having an acoustic neuroma taken out and lost the whole feeling on the side of her face and the function of her nerves, so her eye wouldn't shut. And by applying microcurrent point stimulation therapy in your office, that lady's eye was closed in one treatment. That fires me up. And thanks to optometrists like you who believe in this Better Together vision, who believe in prevention, but also believe in the science and the research that we need to work together, really cool things are happening. So, Dr. Teske, I learn something from you every time we talk, and our viewers and listeners are very lucky to have you as one of our go-to experts to help make us better together, and to show people that vision is more than just what we see, that it really is has everything to do with our overall health. So I hope you'll join us again soon.
Absolutely. Thank you so much for inviting me.
Now, where can everybody find you?
Eyesfocusedonyou.com.
Eyesfocusedonyou.com. Okay, Todd, next time we're going to get you some SmartBoost so that your eyes aren't going to be sore. And for all of you, if you want more information, please do reach out to us. We want to hear from you. Your ideas matter to us because at the end of the day, it is about your health, and we want to stock your toolbox with evidence-based and informed strategies to help you and your family live well. So I'm Margaret Wallis-Duffy, and on behalf of Todd Miller, the entire Your TV team, and let's just do this. Until next time, be well.